Let's talk about hip pain, hip joint pain, the hip joint itself. So the hip joint is a ball and socket, just like our shoulder. And there's lots of different conditions that can occur that can give you hip pain, hip tightness, hip weakness. And a lot of times the hip pain is coming from certain conditions that are going to cause an issue. A lot of people have hip tightness. You got massive muscles that are all attaching around that area. You got your glutes, you got your hip flexors, you got your hamstrings, a lot of internal tiny muscles that help rotate the hip in different directions. So the hip is a complex joint, just like your shoulder can be. And there's different conditions that generally will lead to hip pain, weaknesses, irritations. So any kind of weakness is generally going to be brought about by one is pain. A lot of times pain will stop the muscle from working appropriately. And over time, if the pain consists or persists, you'll then have, weakness in that muscle because the muscles stop firing at the right timing. So our muscles are supposed to fire at certain times in order for everything to produce the right movements and patterns and all the effort through those joints and those muscles that work around them. So in the hip joint, a lot of times the part that's going to cause pain is doctors will a lot of times say it's a bursitis. You have a bursa, which is just a fluid-filled sac, and that is a shock absorber that goes in between the bone and where the tendon attaches. So in the hip, you have a pretty large bursa on the outside of the hip, and that's where that would be a lot of pain on the outside here. A lot of people will complain about it. It's very point tender, so when you press on it, it's really, really tender, gets very irritated. So it's common to have that. But the other piece of that is there's also a tendon that attaches to it or over top of it. So if the one structure is inflamed, there's no doubt that the other structure, the tendon, is also going to become inflamed. So now you have a condition where you have possibly a bursitis and a tendonitis. I think it's a lot of times easy for the docs to just say, oh, it's bursitis. You got pain over here. We see it. We point to it, and you have pain. So it's bursitis. But a lot of times there's underlying issues that are happening that aren't discovered at first. So that's why we as PTs dive into that a little bit more to try to figure out what's really happening in there. And a lot of times as we start to evaluate the patient, start to recognize what's happening, we'll start to see different muscle imbalances throughout all these different muscles in the hip. Your rotators of your hip, like I said, there's some very small, tiny muscles inside your pelvic area that go around both parts of the outside and inside of the hip that help the hip to move. And if those aren't strong enough because they're small, they can cause issues and imbalances. You also have a big muscle deep in your glutes called the piriformis, which some people are aware of that muscle. It's a very tiny muscle. It's where your sciatic nerve runs through. That can get irritated and inflamed, and that can also cause pain around the hip itself. So the main issues that are going to happen at the hip is going to be arthritis in the joint causing pain. There can be tendinopathies or tendinitises, bursitis, those combined things that we just talked about. And there can also be some internal structural issues occurring as well. There's a labrum inside the cup of the socket of the hip joint, and that can get torn, and that can be very irritating and painful and just have a constant inflammation. So that's another thing that's commonly a problem in the hip joint. So between those three major issues, there's all kinds of other things that can happen in there. You can get impingements of the hip flexor muscles and some other muscles in the hip that can get impinged just like a shoulder can, and those can all lead to pain. But generally, anytime there's hip pain, again, mostly what we have to do is we have to work on how do we get the hip moving again. Because with the ball and socket, as you have it here, it's got a lot of different movements that occur in here in a deep socket. And you have lots of ligaments that are surrounding this. You have all these pelvic muscles across the front and the back. And those are the areas that we need to really focus on trying to strengthen and get your glute muscles and hamstrings working appropriately so that you can have less hip pain and more strength.